Good morning, everyone. First, I would like to thank you for giving opportunity, and it's my pleasure to introduce myself. I, J. Sunita. Welcome to my presentation. I request to subscribe my channel. Let's start my presentation with the previous aims questions. And in previous class, we have seen so many questions with explanation. And today, I brought you few more questions from aims paper. Here, first question. Okay, first question, you can see the baby friendly hospital initiative. The baby friendly hospital initiative was launched jointly by which organizations? I give you options: WHO and Red Cross, WHO and FAO, UNICEF and WHO, UNICEF and FAO. The answer is UNICEF and WHO. Okay, and not only that, this BFHI organization initiated in the 1991, and the main concept of this BFHI is to introduce nothing but it introduced 10 steps for successful breastfeeding. Okay, for successful breastfeeding, it came forward, and it is also provide health education how to give breastfeeding to the children. Okay, then next, second, which of the condition can result in hairy patch on the back of the children? Which of the condition can result in hairy patch on the back of the children? The answer is spina bifida occulta. So here, spina bifida occulta. And next one, which is not a clinical manifestation of trisomy 21? Which is not a clinical manifestation of trisomy 21? The answer is long hands and fingers. Then, what are the manifestations of trisomy 21? Trisomy 21 we can also call the Down syndrome. Okay, all we know Down syndrome. Okay, the exact symptom of this trisomy 21: flat nasal bridge, protruding tongue, small nose. And the Down syndrome is a genetic disorder. Down syndrome is a genetic disorder where person has the extra 21 chromosome number 21, and he has total 47 chromosome. Normal person has only 46 chromosome, but this person has 47 chromosome, and that is extra 21 chromosome. Then we can call that Down syndrome. Okay, and symptoms you can see: flat nasal bridge, protruding tongue, small nose. And next one, fourth question, which one of the following not a characteristics of ADHD? Attention deficit hyperactivity disorder. Difficulty in eating. Difficulty eating not a characteristics of ADHD. Here you can see actually what is ADHD. Attention deficit hyperactivity disorder. Attention deficit hyperactivity disorder is a common mental disorder we can see in children, and it lasts into adulthood also. And the three main symptoms you can see in the children who has this ADHD, that is inattention, in impulsivity, overactivity. Inattention is nothing but lack of attention or concentration, lack of self control or acting without planning in impulsivity, and overactivity is nothing but too active. Next question, most common leukemia seen in children is acute lymphoblastic leukemia. Acute lymphoblastic leukemia is the most common leukemia seen in children. The next one, which is not a complication of measles? Arterial septal defect is not a complication of measles. Then what are the complications here? Laryngitis, conjunctivitis, encephalitis. These three are the complications of measles. Arterial septal defect is not a complication of measles. Then, which of the following ideal age for closure of anterior frontale of child? Okay, so when it closes, okay, the frontale, this frontale, two types, one is anterior frontale and posterior frontale. Here you can see the structure of anterior frontale, posterior frontale structure, diamond shape structure, triangular shaping structure, and the anterior frontale closes at 18 to 24 months, and posterior frontale closes at birth to 2 months. Okay, between this period the posterior frontale closes. Then next question, an injury to the upper brachial plexus is erbroplasis. We can call erbroplasis, and we can also call brachial plexus birth palsy. And here you can see Difference between Erb's palsy and Klumpke palsy. And if injury takes place at a C5 C6 upper trunk, it causes Erb palsy. If injury takes place lower trunk, that is C8 T1, then it causes Klumpke palsy. And here the sign you can see policeman or waiter hand, tip hand you can see, and here the sign you can see ape thumb and claw hand. And one more paralysis also you can see here, phrenic nerve paralysis. Okay, so this paralysis caused if there any elevation of one side of diaphragm. So this is the common cause for phrenic nerve paralysis. And next palsy you can see, that is facial nerve palsy or facial palsy. Here the person inability to move muscles which control facial expressions. So whatever muscles facial expression muscles are not moving, controlling muscles not moving properly, so that you can call the facial nerve palsy. The next question you can see, maneuver commonly used to manage a shoulder dystocia is MC Roberts maneuver. MC Robert maneuver. So here what is the shoulder dystocia is nothing but obstruction of shoulder in the pelvic bone, mother pubic bone, called shoulder dystocia. Okay, so here you can see once you see the maneuver. Okay, so here the nurse lift the leg of the woman. So this is the leg of the woman and the flexed leg of the woman, and the nurse flex the leg to abdomen of woman, and when the leg get flexed, it causes rotation of pelvic and alignment of sacrum, and it opens the birth canal, and it decreases the suprapubic and at the time the nurse applied the with her hand suprapubic pressure on abdomen, and that pressure passes to fetal anterior shoulder. That pressure passes to fetal anterior shoulder, and it relieve the shoulder dystocia. Okay, next question. First perception of active fetal movement felt by the mother during pregnancy is. First perception of active fetal movement felt by the mother during pregnancy is. The answer is quickening. Okay, so other than that, what is that quickening? The mother first time felt fetal movement, that you can call quickening. And other than that, we have some terminology also. Engagement. What is the engagement? Engagement is nothing but baby head enters the mother pelvic. If the baby head enters the mother pelvic, that you can call engagement. The lightening is nothing but sensation of baby dropping into the pelvic. That you can call lightening. Then here you can see the difference between engagement and lightening also. Here the largest diameter, biparatal diameter, enters the pelvic inlet, that you can call the engagement. Lightening is nothing but movement of presenting part downward towards the outlet of pelvis is called lightening. Okay, next question we have, which of the following not a tetralogy of Fallot? Patent ductus arteriosus is not a tetralogy. Actually, what is tetralogy of Fallot? Tetra is nothing but 4. Okay, 4 abnormalities of heart. Tetralogy of Fallot is a combination of 4 heart changes, and it is congenital disorder present at birth, common in children. Okay, who has the Down syndrome? The children who has the Down syndrome. So this tetralogy of Fallot is a common condition, and here 4 heart abnormalities you can see in the tetralogy of Fallot, that is ventricular septal defect, pulmonary stenosis, overriding aorta, right ventricular hypertrophy. This you can remember. This hint you can remember. Vinita plays online rummy. Just you strike out this daily. Okay. The next question. Here you can see patent ductus arteriosus. Patent ductus arteriosus is nothing but abnormal connection or blood flow between aorta and pulmonary artery, called patent ductus arteriosus. Actually, there should not be the connection between these two vessels. Okay, you know the circulation. heart circulation. Inferior vena cava, superior vena cava brought blood to the right atrium, and from the right atrium it reaches the right ventricle. Deoxygenated blood goes to the lungs. Okay, for purification. After purification, it backs to the left atrium by the pulmonary veins, and it reaches the left ventricle, and from the left ventricle by the aorta it supplies to all the body parts. So this is the circulation. Here there is no connection between these two for normal person. Is there any abnormal connection between these two? Then you can call the patent ductus arteriosus. So when there is a connection with these two, okay, so then this blood reaches the aorta directly. Okay, this blood reaches the aorta, and it increases the more pressure in that aorta. Okay, then next question you can see, postpartum hemorrhage. Postpartum hemorrhage is the condition in which there is blood loss more than 100, 200, 300 or 500 ml. Okay, if the 500 ml of blood loss is there after delivery, then you can call PPH, right? Okay, and it is divided into two types, primary PPH and secondary PPH. Primary PPH is a postpartum hemorrhage if the postpartum hemorrhage occurs within 24 hours. Okay, sorry for disturbance. Okay, primary PPH and secondary PPH within 24 hours. If the postpartum hemorrhage takes place within 24 hours after delivery, after birth of the baby, that you can call primary PPH. And the secondary postpartum hemorrhage, if the postpartum hemorrhage takes place after 24 hours of the delivery of the placenta, that you can call the secondary PPH. Okay, so which not a feature of HELP syndrome? Which not a feature of HELP syndrome? So eosinophilia. Eosinophilia is nothing but increased number of eosinophils. Okay, type of WBC. Okay, here you can see actually what is a HELP syndrome. HELP syndrome is the full form of HELP syndrome is hemolysis, elevated liver enzymes, low platelet count, and it is a rare pregnancy complication that affects blood and liver of mother. Okay, and in that you can see the woman who has this HELP syndrome has the problems like hemolytic anemia, raised liver enzymes, and thrombocytopenia. Right? Okay, the next. So increased eosinophilia is not a feature of HELP syndrome. The next. Normal Apgar score of newborn is. Normal Apgar score of newborn is. Normal Apgar score of newborn is 7 and above. Okay, and Apgar score, what is the Apgar score? Apgar score, okay, here Apgar score is a test. The purpose of this test is to measure the newborn health, and in that we can see the parameters like activity, pulse, grimace, appearance and respiration, muscle tone, reflex irritability, skin color. Okay, then it includes the 5 factors. The next one, 15th one, correct sequence of development of puberty in girls. Correct sequence of development of puberty in girls. So what is the sequence? Actually, what is the puberty? Sexual maturation we can call the pin. That the sequence is telarche, pubarche, menarche, TPM. Okay. Then next, here you can see telarche, beginning of the breast development, and pubarche, first appearance of pubic hair, menarche, first time menstrual cycle. Okay. The next question, during active phase of labor, in first stage of labor, okay, during first stage or active phase of labor, cervical dilation per hour in primary gravida is approximately 1.2 centimeter or 1 centimeter per hour, or more in normal labor also. The next, of the 6.7 million oocytes available, how many are released during ovulation? Of the 6.7 million oocytes available, how many are released during ovulation? So in these many oocytes there, in that how many oocytes released during ovulation? And the answer is 4 to 500. Just 4 to 500 oocytes released during available. Sorry, 400 to 500 oocytes available during ovulation. Okay, the next, onset of menstruation called menarche. Then most important tumor make to diagnose carcinoma of ovary. Most important tumor make to diagnose the carcinoma of ovary, that is CA125. CA125. CA125 is a protein found on the surface of the ovary cancerous cells. Ovarian cancer cells. The next, PEG cells are seen in fallopian tube. Okay, PEG cells are seen in fallopian tube. Here you can see fallopian tube made up of three types of epithelial cells. In that, one is PEG cell, and what is the function of this PEG cell is it is a non-ciliated epithelial cell that secretes nutrients for egg cell. Then outermost member of placenta is called outermost membrane of placenta called chorion. Okay, here you can see the diagram also you can see, and so outermost, the placenta layer, outermost one is chorion, and inside amnion and inside embryo. Okay, and outside on the chorion layer you can see the structure, villi like structure, that you can call chorionic villi. Then which one of the seen in preeclampsia? Which one of the symptom? And that is proteinuria. Proteinuria is the sign to find out preeclampsia. And here, what is preeclampsia? Preeclampsia is nothing but, so it is one of the persistent high blood pressure during pregnancy or postpartum period with high levels of protein in urine. Okay, and it is also decreased blood platelets in the body, and not only that, it is also causes liver and kidney damage. Okay, the next, early puparium. Early puparium extends. Okay, here you can see until first week of postpartum. Which of the following hormone increased in polycystic ovarian syndrome? Which of the following hormone increased in PCOD or polycystic ovarian syndrome? The hormone is luteinizing hormone. Next, average weight of placenta at birth. Average weight of placenta at birth 500 grams. Next, the darkening of skin over the forehead, bridge of the nose or cheeks bones during pregnancy called cloasma. Okay, then common site of ectopic pregnancy. Common site of ectopic pregnancy is ampullary region in the fallopian tube. Okay, this is the ampullary. Okay, ampullary region of fallopian tube. The next one, inflammation of fallopian tube called salpingitis. Okay, the next, the uterine fibroid. Okay, the uterine fibroid associated with the uterine fibroid. The cause of uterine fibroids are, the reason is endometriosis. Endometrium grows outside the uterus. Is called endometrium. Once you look at the complete paper, the next, which of the following indicates relationship of long axis of the fetus to the mother? Relationship of long axis. So this is long axis. Okay, long axis of fetus to the mother is called fetal line. Okay, the next, fetal eye is nothing but, here you can see some terminology also. Fetal eye is nothing but fetus relation to the mother's spine. Okay, what is the fetus relation to the mother's spine? Called fetal eye. And the fetal presentation is nothing but, so which part of the fetus closest to the birth canal during labor called fetal presentation? Maybe vertex or breech presentation you can see, vertex presentation you can see. Okay, face presentation you can see. Okay, so what the part is present closest to the birth canal, that one you can call fetal presentation. Okay, the next one, fetal attitude is nothing but relationship of different parts of fetus to one another. Relationship of different parts of fetus one another. Okay, example you can see flexion. Okay, fetal flexion is example of fetal attitude. Then, what is the ideal average newborn head circumference at birth? 35 centimeter. Postpartum pregnancy. Postpartum pregnancy is pregnancy which continues beyond. When you call postpartum pregnancy, if it crosses 294, okay, beyond, okay, 294, then you can call the postpartum pregnancy. And here so normal is 280 days, and if it crosses 280 or it reaches up to 294 days, then you can call the postpartum pregnancy. And by weeks you can see if it is in 37 early term, if it is 40 weeks full term, if it is beyond 41 late, or it is 42 weeks, then you can call postpartum pregnancy. The next, oxygenated blood from placenta returns to fetal via umbilical vein. Okay, next question. Oxygenated blood from placenta returns to fetus via umbilical vein. Okay, so here you can also see the same as pulmonary vein function. So umbilical vein carries oxygenated blood and pulmonary vein also. Umbilical artery carries deoxygenated blood, and here pulmonary artery also carries a deoxygenated blood. Okay, the next, umbilical cord contains two arteries, one vein. So here you can see the structure of umbilical vein. So two arteries, one vein. Mitotic sequence. Okay, so here you can see the mitotic sequence and phases of mitosis. Here the correct sequence is, just you can remember PM80. Prophase, metaphase, anaphase, telophase. Prophase, metaphase, anaphase, telophase. PM80. Okay, the next one, common cause of non-engagement in engagement at term in primigravida. Common cause of non-engagement. Engagement already we discussed. Engagement is nothing but settlement of fetus skull in the pelvic brain. Okay, so here non-engagement. The cause of non-engagement at term in primigravida, the common reason is cephalopelvic disproportion. Cephalic pelvic disproportion, there is no relation between the pelvic and cephalic of fetus. Okay, here next, ovarian cycle started by or initiated by. Ovarian cycle initiated by hormone, FSH hormone, follicular stimulating hormone. The next one, dash of gestation, the height of the uterus at the level of umbilicus. At which week? Okay, which week the height of the uterus is above the level of umbilicus, that is 20 to 22 weeks. Okay, 20 to 20, between 20 to 22 weeks you can see the height of the uterus above the umbilicus. Okay, here you can see the structure. Okay, this is the umbilicus, and 20 to 22 weeks between you can see the height of the uterus above the umbilicus. Okay, and at 12 weeks you can see it is symphysis pubis, 20 to 22 above umbilicus, 36 xiphoid process, and 37 to 40 fundal height between 36 to 30 regression. Okay, 37 to 40 regression of fundal height between 36 to 32. Okay, the next one, after postpartum below 24 hours, again the height of the umbilicus height of the uterus reaches umbilicus. Next question, common site for fertilization. Ampulla. Okay, the next one, setting of fetal head into the brim of the pelvic skull. Setting of fetal head in lightening. Okay, the next, urine formation usually begins towards the end of the dash and continues throughout fetal life. Nothing but in fetal life, when the urine formation begins, 11 to 12 weeks. The period of 11 to 12 weeks, the urine formation, the fetal in fetal life, the urine formation starts. The next one, the suture separates the parietal bone from the tabular portion of the occipital bone called lambdoid suture. Lambert suture. Here you can see the structure of the sutures. Okay, so here anterior frontale in already we discussed anterior frontale, posterior frontale. This is a frontal bone. Okay, in between the frontal bone, metopic suture, and we can also call the frontal suture also. And here two parietal bone, and the sagittal suture separate the two parietal bone, and here you can see occipital bone. Okay, the suture which separate the parietal bone and occipital bone is Lambert suture. Okay, the suture which separates the two frontal bone, metopic suture. The suture which separates the parietal bone, frontal bone, coronal suture. Okay, then shape of anthropoid pelvis. Shape of anthropoid pelvis is oval shape, anthropoid pelvis. And here you can see the types of pelvics and their shape. 4 types of pelvics there: gynecoid pelvis, anthropoid pelvis, android pelvis, platypelloid pelvis. Gynecoid is round shape, anthropoid pelvis anterior posterior or oval shape we can call. The next android pelvis is in heart shape, oval shape, round shape, and this is platypelloid pelvis is in kidney shape, and you can also call the transfer oval shape. Okay, and the ideal pelvis for delivery, pelvis for normal delivery is gynecoid pelvis. Length of the fallopian tube. Length of fallopian tube is 7 to 12 centimeters. Then first stage of labor characterized by dilation of cervix. Okay, here you can see the again stages of the labor, 4 stages of labor. First stage characterized by cervical dilation, that is 10 centimeters. Second, fetal delivery. Third, placenta delivery, and fourth, recovery stage of women. The next next question, most common genital prolapse. Most common genital prolapse is cystocele. Cystocele is nothing but bladder enters into the vagina or bladder descends into vagina. Then genital prolapse. Genital prolapse is nothing but descent of pelvic organs into the vagina. Okay, descent of pelvic organs into the vagina called genital prolapse. Okay, then graphical record of maternal and fetal data. Graphical record of maternal and fetal data against time during labor in a single sheet of paper called partograph. Okay, then where the uterus stands inside out called uterine inversion. Ovulation of female, female has 36 days cycle, and the ovulation occurs on, answer is 20th to 24th day. Okay, so generally normal woman has 28 cycle, but here the woman has 36 days. So what you have to do, you have to do the 36 minus 20 days, nothing but extra 6 days the woman has. Okay, normal woman has 28 days cycle, but here woman has the 36. So what you have to do, you have to minus 36 28 from 36, then extra 6 days the woman has. So 14th day is the ovulation period, the woman who has 28 cycle. Then what you have to do, you have to add the 14 plus 6. Here we got extra 6 days. Okay, so 14 plus 6 you need to do, then you will get the 20 days. Okay, so 20th day to 24th day is the ovulation period for this woman. Okay, then the disulfiram therapy is indicated in chronic alcoholism people. Then next one, here the person has the severe anxiety disorder, able to speak freely with certain people, not to all people. Okay, with only few people, 1 minute. Okay, with only few people, and is not able to speak with others, especially with a certain social group such as classmate school, and that one you can call selective mutism. Mutism is nothing but inability to speak called mutism. Okay, but here the person is talking to only few people, he is avoiding other people, so that is called selective mutism. Aphasia also you can see, and this is also one of the symptom you can see in the people who has a psychiatric problem, like what is that? Aphasia. Aphasia is nothing but ability to understand and communicate effectively. Nothing but affects the, so normal person has the ability to understand and communicate effectively, but it affects the that ability, what the child can understand and communicate. Nothing but he can't understand and he can't communicate properly to someone. Okay, the next one, labelly indifference is related to conversion disorder. Okay, so what is a labelly indifference? So labelly indifference is nothing but here the person has a lack of concern, and he not have the attention, he not have the attention to others, nothing but pay little attention to them. And not only that, you can see this one in the people who exposed or who has a history of uh, death of loved one. Okay, then next question, false sensory perception without real external stimuli is called hallucination. False sensory perception without real, without external stimuli, hallucination. With the stimuli you can call illusion. Without stimuli, hallucination. With illusion, sorry, with stimuli you can call illusion. Next question, following derived from the plant cannabis sativa, and that is ganja. Then which of the following is not a symptom of OCD? No fear of self-harm. No fear of self-harm is not a symptom of OCD. Obsessive compulsive disorder. But what are the symptoms of OCD? You can see fear of germs or diet, obsessive thoughts, repeated thoughts, or repeated actions. Okay, these three are the characteristics of OCD, but no fear of self-harm is not a characteristics of OCD. Then, according to Erikson 8 stages of development, initiative vs guilt takes place at 3 to 5 years. Okay, here you can see the stages of Erikson 8 stages. Early infancy, trust vs mistrust, toddler stage, autonomy vs shame and doubt, early childhood, initiative vs guilt, middle childhood, industry vs inferiority, adolescence, identity vs identity confusion, young adulthood, intimacy, isolation, middle adulthood, generosity vs stagnation, older adult, integrity vs despair. Following expect in a patient who has a diagnosis with organic mental disorder. So what you can expect, the person who has this organic mental disorder, disorganization of thoughts, painful swallowing call, like liquids and foods, odinophagia, and dysphagia. Some important terminology you can see, dysphagia, difficulty in swallowing, dysphagia is difficulty in swallowing, odinophagia, painful swallowing, dyspepsia, cause pain or discomfort in upper abdomen, and ataxia is nothing but lack of muscle control. Antidote of warfarin is vitamin K, and here also you can see some antidotes. Antidote for heparin, prothioamine sulfate, and antidote for warfarin is vitamin K. Paracetamol antidote is N-acetylcysteine. Then common lung cancer in non-smokers, adenocarcinoma is a common lung cancer in non-smoker. Presence of stone in the urinary tract called urolithiasis. If the stones present in gallbladder, you can call cholelithiasis. Thank you. I hope you like my content, and please subscribe to my channel. Thank you.